Hi, good afternoon. I'm Dr. Annette Mercatante, and I'm here to talk about COVID with you on Facebook Live. So please enter your questions into the box, and we'll get to them as soon as we go over the case rates. So let's get started with the data. As you can see, we're over 20, almost 25,000 total cases. For the year, I think we calculated that a little earlier, we're almost 20,000 in the 2021 year. So a lot of those cases have been just since January. We have over 890 hospitalized, over 500 deaths, and the changes in the last 7 days are probably the most significant part of the story. We have seen 1,100 new cases. We have about 160 average new cases per day, and those I'll just reiterate, those are the known cases that we have. We have had 5 new COVID deaths, and our percent positivity for testing is up to 20%. So big change in the last week or two. And we'll go to the next slide and you'll be able to see that on the epi curve. So we've been sitting there on that plateau now for weeks and weeks, and I kept telling you nothing's changed. We might go up, we might go down, we may stay the same. Well, the story's over. We're going up. That's where we're going. And the rest of the state's going with us. So, how far up we go and how long we'll stay up, it's hard to say. I guess the good news from our informatics guy is that when you see a curve accelerating this quickly upward, we can maybe have some hope that it'll come downward just as quickly. But it's obviously very hard to say. And the next week or two will be very telling. Next slide. Our vaccination status is coming along nicely. Good response to booster doses. Kind of a lukewarm response to vaccines for our under 15-year-olds. Although we vaccinated close to 4% of our, is that there? 5 to 11-year-olds? I don't see it though on there. You didn't adjust that age group range. The 5 to 11-year-olds is about 3.8%. Am I reading that wrong? Okay. Sorry about that. We'll fix that. So our 5 to 11-year-olds, which is the newest eligibility group, is getting vaccinated, but I can tell you that's well below what the state average vaccination rate is. So once again, St. Clair County, we have to be careful of putting ourselves in a much more vulnerable position as this virus cranks up. Next slide. And as always, our dashboard is available to you where we try and give you links to not only our numbers, but the state and the national data so you can see where we're going. And I believe that's all the data we have for today, right? I think so. Okay, so let's get to your questions. I think, Jennifer, you said the first situation, you just want me to reiterate talking
Yep,
points
the
is
talking points.
the
Mhm.
cases increasing. So I just mentioned that we are seeing a dramatic upward trajectory of cases, and we've been through this before, and we know what this means. So first we see more cases, then we see more serious illness, hospitalizations, and then the deaths are a lag measure. So the first and most important thing to say and remember and to do is to avoid infection in the first place. That means to get vaccinated. If you've been delaying getting vaccinated, it's not too late. If you've not completed your vaccination process, do so. And if you're due for boosters, if it's been 6 months since your primary series, please come and get a booster. Encourage your family to get vaccinated. If now that we're at this high rate, CDC recommendations are for everyone to wear a mask, vaccinated or unvaccinated, particularly indoors and in congregate settings, outdoors if you're close together, and around a lot of other people. So get those masks out and use them. And finally, we want to remind everybody that the larger the crowd, the more you travel, the greater your risk. If you're going to do so, another layer of protection can be testing. So if you're having some family or friends over, try and keep those crowds small, that group small. But another consideration is to have everyone test before they show up and mingle in your household for a few hours. So testing strategies can be very helpful. Again, it's layering of these strategies. So between uh, ventilation, vaccination, distancing, masking, and testing, you can really kind of help protect everyone from a real rapid super spreader event. It was what we want to avoid. We can't stop this from happening, but we can certainly avoid large amounts of people getting infected at the same time. The only thing I want to mention, we're getting a lot of comments now that things are cranking up. How come we're not doing anything? And I will just say this: we are telling everyone as much as we have to tell you. We are giving you advice, expert guidance, and it's like us writing a prescription. If you were our patient, we would be writing you a prescription and handing it to you and saying, do this. That's what we're doing for you now. It is your decision whether you are going to do it or not. And I would strongly encourage you to follow our advice and follow our prescriptions to try and minimize the risk to you and your family. The other thing I just want to mention is that next week is Thanksgiving. Happy Thanksgiving, everyone. And we will not be doing a Facebook Live next Thursday. We'll be back the following Thursday, which is November. Nope. What date is that? I don't even know.
December 2nd.
December 2nd. We'll be back on
Yep.
December 2nd. What happened in November?
I
What
don't
happened in
know.
September? I don't
Mm-mm.
know. Okay.
Okay, we had one question come through before the show, and then I'll get to the live. The first question is, why aren't the nursing homes or assisted living facilities in the area not making it mandatory for their employees to be vaccinated? They are having outbreaks via patients and employees. I have two family members who work at different facilities, both of whom are vaccinated, by the way, and a vaccinated relative staying in one of them. I find this disturbing. Thank you for all you do.
Yeah, we all ask that question. So how come this group isn't vaccinated? How come that group isn't vaccinated? And that's because we live in a country that does provide free will and free choice for things like this. However, as you know, the federal government did release some vaccination requirements. They're moving through with that. I believe by January 4th is the deadline, although they are being challenged in court. So a lot of that's up in the air. So it is still up at this point for individual agencies and institutions to establish their vaccination policies. And we encourage them to do as much as they can to be very practical. Sometimes vaccine mandates drive staff away, and many of our agencies can't afford to lose staff. So it is a balancing act that everyone is really deeply considering and struggling with. And again, it's one of those things that you can look from one side of it and say, "Oh, that's really obvious and simple," but the solutions are often much more complex than they may seem. So we want to just keep encouraging people to move in this direction, and if they have staff or residents that aren't vaccinated, to do everything possible to kind of wrap them up in a safer environment.
Okay.
Hmm.
Well, there's quite a few questions that are coming through on the live feed. And I just remind everybody, if you have a question, put it in the write a comment section and we'll get to it. We will probably be ending today at 4. And if we missed you along the way, please email us at covid19@stcounty.org. Okay, first question is from Amanda. She said, did they lift the mandate?
What mandate? Did what? Which mandate are we talking about?
I
Did
don't
we?
know. I'm not
Okay,
sure
so
which
the
one.
federal mandate, as far as I know, is still on, although as I mentioned, there's multiple challenges. I leave that to the courts and the legal system. I'm not aware of any other mandates at this point.
Amanda, if you're still on, if you want to elaborate, we'll get back to you. The next question is from Kelly. She asked, "Why aren't people wearing masks?"
I don't know. I do. I am. Masks. So we had a nice calm summer, and people got out of the habit. And um, you should be putting your mask on, people. Put your masks on. It's kind of funny. I go some places and a lot of everyone's masked, and I go other places and no one's masked. So just put your mask on.
All right, the next question is from Denise. She asked, "With COVID spiking again, can you say how many of them were fully vaccinated?"
Mhm. Okay, for November, about 70 breakthrough cases so far, and 1,900 unvaccinated. So the number of cases in the unvaccinated population still greatly outnumbers those who are vaccinated. So we're still seeing the numbers supporting the value and the efficacy of the vaccine significantly. So hang in there with that. We're watching that closely, uh, but and I'm assuming that boosters are going to help even more. But we are still seeing the vaccinated population not having nearly as many cases and considerably less hospitalizations and deaths as well.
Okay, the
Thank you for
next
those numbers.
question is from Kelly. She might have missed the opening um, data review, but she asked, what are the case numbers in the last week?
Oh, the average case numbers are, see, 1,135 new cases in the last 7 days. Okay. And I will reiterate again that those are the known cases. For every case we know of, there are certainly several more that are unaccounted for. So do keep that in mind. Where would that 1% mark be when we get to a 1% of the total population? 1,600? 1,600. So we're there. We're there. At least 1% of the population in any given week is infected with COVID. So consider that.
Okay, the next question is from Melissa. She asked, do you see more cases in the kids' schools?
Well, when cases go up, we see more cases everywhere. Okay, so yeah, we see more kids. The proportion of cases in that age group are pretty much the same as they were before, are they not? Okay, right. So the shift with vaccines and everything all along is that we're seeing um, the distribution of cases being more in the younger age groups. Um, but that proportion of age groups is remained pretty steady as we increase. Okay, so and I don't know the exact proportions off the top of my head. Brandon might know that, but what we're seeing is that as cases increase, they increase in all the age categories, but in the same proportional amount. If that makes any sense.
Okay,
So
the next
everybody's
question.
vulnerable. Everybody's vulnerable, and the more you see people together, the more likely they're gonna spread. So go ahead.
All right, the next question is from Linda. She asked, what is the difference between the third shot and the booster?
Well, in most cases, if you've had an mRNA vaccine series, your booster is your third shot. So there's a lot of people talk about get your third shot. If you're fully vaccinated, your third shot is your booster. If you're immunocompromised, your third shot is part of your primary series of your mRNA vaccine. We're recommending people who are immunocompromised to get a 3-shot series in their initial vaccine series. And of course, with J&J, that's irrelevant. J&J is a single shot, and then the booster is another single shot.
Okay. The next question is from Denise. How many children ages 5 to 11 have received dose in St. Clair County?
About 500.
All right.
Not a lot, but
Kelly
better
has
than
asked,
nothing. Good.
Kelly asked, what age group is the largest number of cases?
It's pretty roughly divided, is it not? Yeah, 0 to 18 is about 20%, is that right? And what, 19 to 36 is another 20 to 25%. So those are our two highest age groups. So again, the younger generation, but then every age group has a proportion of cases as well.
Hey,
What is the older population? Okay, 10% over the age of 65.
okay. The next question, well, Kelly stated, vaccine status is high, but so are the new cases.
Right.
Nancy says that I noticed that WGRT posted something on their wall quoting you saying this, Dr. Mercatante. Dr. Mercatante encourages people to consider extra safety measures for holiday gatherings. If people decide to gather, they should make sure guests are vaccinated and consider having visitors do a rapid COVID test 48 to
Right.
72 hours before the event if anyone in the family is at high risk for serious disease or complications. You would think that business would do the same instead of having concerts, parties, etc. I just can't believe people are going on without a concern.
I agree. And up until a week or two ago, we were at this plateau and people were kind of complacent. And I don't want to say I told you so, but we told you so. We were concerned all along that we'd go from a plateau up, and not down, because that's generally how it goes. So yeah, I would really think very, very carefully if you're planning a large indoor holiday event. I think it's not in your audience's best interest. Everyone considers risks and benefits for themselves, so I'll leave that up to you. Again, there is no orders or mandates to not allow for this, but I don't think it's in the best interest of your guests to have a large group. And I certainly think for family gatherings, asking people to be extra careful is just a loving thing to do for each other.
Right. Okay, Sharon asked, what can you tell me about antibody levels? Both my husband and I had our levels checked during our annual physical in late October because we were curious. My level
Hmm.
is 3,400 and his is 4,200. And to our knowledge, we have never had COVID. We are both over 65 and received the Moderna vaccine. He was completely vaccinated in February. I was completely vaccinated in April. We are wondering if we should get the booster and when.
Number one, yes, you should get a booster regardless of what your levels are, because I can tell you nobody knows what the appropriate antibody levels are. And of course, there's the secondary complex issue of it's an antibody to what? Is it an antibody to a spike protein? Is it an antibody to a core protein? Is it an IgG antibody? Is it an IgM antibody? So I've said this a number of times that although serology can help you decide whether or not you've had an exposure, or a previous history of vaccination, which obviously you know by your own history, it doesn't tell you that you are or are not protected. And we shouldn't be making decisions at this point in the pandemic on what you should do based on blood tests. So you're both vaccinated and your blood work seems to reflect that that vaccination is good, but we can't tell you that those levels are in fact protective or not. So the recommendation right now, and I think it's solid, is to get a booster. We know that boosters significantly boost our immune system and gives you that added level of protection, especially now when we have this huge surge going on. So hopefully we'll have more information about serology as the science evolves. But right now, it doesn't really help us much clinically. And this is what I've been trying to tell our physicians a lot. It's reassuring to know you can detect antibodies, but I don't know how it's going to change your recommendations, your clinical recommendations, or what we tell you to do.
All right, the next question comment is from Shay. I apologize if I said your name wrong, but I pronounce it Shay. I'm at a loss as what to do anymore. I'm double vaxxed, even got a booster, and COVID runs rampant in our state.
Mm.
I feel I'm doing what I can do, but to no avail. What's the point? I'm hopeless.
Don't feel
Oh,
hopeless. We're all feeling this way, right? We're all feeling we're doing the best we can. Well, I was talking to a colleague today in a county that has one of the highest vaccination rates in the state, and her community is running crazy too. This is a nasty virus. It's a new virus. We don't know how to deal with it as well as hopefully we will in the future. So what should you do right now? Um, Buckle up. Be careful. Don't go around people who are vulnerable. If you get sick, get tested. And if you're in a high risk group, if you have conditions, medical conditions that put you high risk, seek out monoclonal antibody therapy. Okay, you need to get that monoclonal antibody therapy within the first 10 days of the onset of your symptom. The earlier, the better. So we're trying to reach out to our healthcare providers and to our system to try and develop a system that makes it easier for people to get monoclonals. We're working very hard on that right now. So I know there's some bottlenecks and I know some people who are seeking it and can't quite get to it. So that's really our goal right now. So the first goal is try not to get infected in the first place. You can't get infected with the virus if you're not exposed to it. So it's hard because the virus can be shedding without the person knowing it. So I've gone through this a million times, right? Masks, distance, ventilation. If you can have your group tested before you're all together, that's another little extra level of reassurance. And if you feel ill, get tested right away so you know what it is. We have another couple other viruses right now to be really concerned about. We have a high level of RSV circulating. It looks like we're going to have a flu season. So it's really about just protecting yourself against a lot of respiratory illness, because any amount of respiratory impact or infection impact on top of what we already have is going to be really hard on our healthcare system. So we got to make some sacrifices yet again. And if you don't, you are going to be taking those extra risks onto yourself. Don't feel hopeless, though. I know it feels that way. I'll just say this: this will end at some point. We're going to get through this. Everyone thought a year. I never thought a year. I always said 2 years, and now I'm getting into the 2-year mark. So, but we will eventually get to the point where this infection is stable and we know a little bit more how to manage it. I don't think it's going to go away. I really don't. I think it's here to stay, and we're just going to get better at identifying the surges and figuring out how to do it. So do something fun. Try and make yourself happy in a safe way. Okay, besides a big indoor party, find some other things to give you joy and pleasure that are healthy for you. If you're really struggling, seek out mental health care. There's some great websites. Do we have those still tagged on our website, Jen? I
Yeah,
know
yeah,
Community
COVID
Mental Health
resources.
has some great links for mental health that you don't even have to leave your home for. And just check one of them out. Try them. Meditation, mindfulness, music, dance in your living room, whatever it takes. But try and fight that hopelessness, because I think it just kind of wears on us pretty heavy.
Yes. Okay, this is from Bonnie. She said, I had a reaction to Moderna's 2 shots. It's inflamed my joints and hasn't let up yet. What do I do since I cannot get a Moderna booster?
Yeah, so you could consider getting a J&J booster, okay, because that's a completely different vaccine formulation. Talk to your doctor a little bit about this, but that would be one suggestion. The only other suggestion, and that again, this would be based on your overall risk. Can you avoid infection during this high risk season? Can you lay low and avoid exposures, or do you really have something where you're going to be out there and being exposed all the time outside of your ability to control it? So if it's the latter, I might consider getting a J&J booster. Um, I think probably avoiding the mRNA vaccines would probably be the most logical at this point.
All right, the next question is from Gina. She asked, what are the chances of getting COVID twice and how many people are getting reinfected?
I asked that question myself this morning, and it's a little too early for that data to be really reliable, but we are seeing reinfections. It's more likely to be reinfected if your first or excuse me, it's more likely to have a second infection after a natural infection. Okay, so if you get COVID, if you had COVID last March, you're more at risk for getting COVID again. The second issue is the breakthrough infection from vaccine. As I mentioned, we're seeing some of that as well. It's not the most likely, but it is real. Do you have numbers for that at all, Brandon? I'm sorry. No, the second infections, like a person who's had confirmed infection once before. We also know, and I'll just say that 3 to 6 months seems to be standing pretty well. It's unusual to people get reinfected within that 3 to 6 month range. Certainly very unusual to get reinfected within 3 months of the first infection. But a lot of people were infected almost a year ago, right? Or certainly last Christmas. So um, that puts you in this like kind of iffy range, which is where all the recommendations are coming for boosters, right? That's where everybody's pushing for boosters, because those first couple of big waves were a year ago, and we know that the immunity clearly seems to wane after that 6 month mark. I'm sorry. We'll have to get back to that actual to give you some idea of like what's the actual proportion of reinfection. That's actually kind of a really hard data point for us to pull. It's not an automatic thing. We'd actually look and see who's been listed twice, and it's complicated. We'll see if we can get to it.
Okay. The next question is from Linda. Is GB syndrome have anything to do with vaccines?
Guillain-Barré syndrome has been watched very closely because, as you know, it's been associated with influenza vaccine periodically, although even that is a little iffy. It's a rare condition, often associated with viral infections. So it is definitely associated with any viral infection, including a COVID viral infection. The vaccine itself, I believe there was a concern with, is it Moderna? I'm sorry. It was one of, it wasn't J&J. It was one of the mRNA vaccines where they were watching that closely, but it does not appear that there's a real significant increase in Guillain-Barré at this time with any of the vaccines. So when you have a really rare condition, it takes a lot to find an increase in cases. And I can tell you, after the millions and millions of doses, if there is an increase in Guillain-Barré, it's really small. And the real issue with this is that post-viral infections, real viral infections, are absolutely associated with Guillain-Barré. A similar example is the myocarditis that's associated with the Pfizer and young men. So the risk of myocarditis after an infection with COVID is 6 to 10 times higher than your risk of myocarditis by getting the vaccine. So even though that risk is elevated in a certain age group with that Pfizer vaccine, you're still better off getting the vaccine than you are getting the infection for exactly the same concern. So we just got to keep that risk benefit in proportion.
All right. The next question is from Amanda. Has there been any recent suggestions that PCR tests are inaccurate?
No, PCRs are the molecular tests are the gold standard. And then, of course, we have the antigen tests, and there are all kinds of manufacturers and labs that run these. Now, I imagine periodically we're going to see some recalls of tests that maybe the lots were ineffective, but I'm not aware of any recently that I'm aware of where they were recalling lots of testing reagents or anything like that. So all tests have the risk of being falsely negative and falsely positive. No test is 100% accurate, but for the most part, our tests, the PCR tests, are the most reliable and can actually potentially stay positive much longer than a person is infectious. So we can go offline. Do we have some of that on our website too? I thought on the FAQ we had a nice little explanation of tests and the sensitivity and specificity of these different tests and what that means. So it probably explains it way better than I just did. So I would encourage you to go and look that on our website because did try to explain that a couple of times.
Okay. Barry kind of echoed something similar to what Gina did with this. Why isn't anyone tracking reinfection rates of people that have already had COVID?
Well, we are. Pe- People think data collection is easy. What did you say? Yeah. Yeah. So I'll say, so we do know that we know of at least hundreds, are you saying? Hundreds of people who we know are reinfected in our county. What we really don't have is a way of accurately pulling that data on a regular basis. It's not being tracked consistently. I don't even think at the state. Are we getting reports on reinfection rates? We're not. So yeah, of course it can be done and it probably will be done, but I can tell you that the art and the science of collecting data is especially with the system that we're using, the Michigan MDSS, the Michigan disease surveillance system, it's pretty challenged right now with the sheer volume of what's going into it. And it's hard to shift gears. So we just had some issues last week with it with a data backlog, and just so we just need to be careful when we report information that we said this a million times. Real-time data should be used as an estimate of direction and trending. It shouldn't be used as an absolute indicator of volume or quantity, okay? Because it's not been scrubbed, it hasn't been cleared over time. So we have to think about the data we have now. It's valuable and it's useful, but it's not accurate in the numbers part. It's accurate and informative when it tells us which direction we're going and whether or not there's something emerging that was unexpected. Okay.
Okay, Doc, it's 4 o'clock and we have quite a few questions left. You want me to just go through?
Yeah, this is a kind of a rough time right now, so I think we should.
Okay. All right. The next question is from Jessica. How many cases are related to vaccinated people who do not have their booster shot at this moment?
Mm, that's a real tough one. I don't think we can go there. Brandon, can we go there at all? How many breakthrough cases unrelated to boosters? Sorry. I would say it's much less. We do know from the science that booster shots markedly improve serology and protection. You get better protection from a vaccine booster than you do from a reinfection of the uh, virus. Okay, you're better off with a booster shot than getting reinfected. S- Oh, he does. Okay, there is some data on the CDC website. Okay. Okay. So being unvaccinated gives you a 2.34 increased risk of reinfection versus being fully vaccinated. CDC website does have some of that. These numbers, I've watched them change 10 times in the last year. So again, I think what you have to remember is the overall big picture. Less infection if you're vaccinated, and the booster gives you even probably less risk of that reinfection rate than if you were not. Something we pretty confident about. The exact amount of reduction in cases remains to be figured out. Go
Okay,
ahead.
the next question is from Amanda. Any thoughts on the Pfizer COVID pill?
COVID. Oh, the antiviral. Yeah, we've been talking a lot about it, and the initial clinical studies would suggest what about a 70% reduction in hospitalizations if taken within the first, I don't know. It's tough. You got to take it really early in the course of disease. It's not been approved yet. We're kind of thinking maybe we'll see something in the next month, but more when we get more information. But obviously, people love pills. It'll be a game changer to try and get a pill instead of having to get an infusion. But I suspect there'll be value to both of them, and there'll be situations where one is more appropriate than the other, where these treatments aren't going to cancel each other out.
All right, the next question is from Dana. Where can you get a rapid test and are they over the counter?
Yeah, there are some rapid tests. I bought one at Rite Aid the other day, just to have at my home, just in case. They were it was about $20 for 2 tests, but I don't know that they're always available, so you can look in your pharmacies and see if you can find them. You can also get rapid tests. You can get them here. You can get them, Jen, Test Finder.
Um,
Is that where they
yeah,
go to look for
you
different
can.
locations?
We also have a St. Clair County and surrounding areas document on our website that lists different areas that have testing for COVID, and it will specify who has rapid and who doesn't. So that's another source, or you can go to that test finder in general. Okay, the next question is from Miranda. I'm so very sick with fever and sinus type issues, and it feels very different and it hits very hard and very fast, but testing negative for flu, strep, and COVID. Any ideas of what may be going around?
Yeah, lots. There's lots of viruses. There's hundreds of viruses, and we are seeing a lot of almost all of them flare up in the cold weather when everyone goes inside. So if you don't have flu, which has an antiviral treatment, and you don't have COVID, which obviously is very significant for a reduction in transmission, then you probably have one of the many others. It could be RSV, but it could also be parainfluenza or Coxsackie. I mean, there's a number of viruses. So you treat it the way you would treat anything. You want to make sure you lay low, you don't expose other people to your germs, treat your symptoms. And if you feel like you're not getting better or your symptoms are getting worse, you should seek medical attention.
All right. The next question is from Michelle. Is the monoclonal antibody infusion available at our local hospitals? If we test positive, how do we get this?
Yeah, so you need a doctor's note. So you need to speak to your physician. The infusions are available at all of our local hospitals, as well as we have a system through Tri-Hospital EMS. They're all not able to expand rapidly. So I'll just tell you right up front that not everybody who seeks monoclonals is going to be able to access it at this point. There is eligibility requirements of, being at certain uh, risk factors that would allow you to get it. So the first step would for you to reach out to your physician. And if you're having difficulty, give us a call.
All right. Shay responded back and said, the one that was feeling
Mm.
hopeless, excuse me, said, "Thank you, Dr. Mercatante, for addressing my quandary. I'll need to seek someone to talk to. I'm scared, but thank you."
We're all scared, Shay. That's the reality. If you're not scared, you're not paying attention. Um, and so, the real question is your fear starting to influence your ability to function. Are you doing things as a result of your fear that are interfering with things that you normally enjoy? Are you able to take care of your family and yourself? If you're starting to struggle with those things, please, please, please get some help. It makes a difference. It really does. And the sooner you do it, the bigger the hole, the harder it is to climb out of. So it doesn't hurt to reach out. There's a lot of online services. There's things out there that are free that you don't even have to like pull out your credit card for. So by all means, seek out a little bit this and see and just kind of see how it's going. I really do think at this point, almost everybody, if they're not really feeling pretty shook up and unsettled, then you're probably covering it up. You got to be paying attention to this, people. We've got to be shifting how we feel. So, just pay attention to yourself, pay attention to each other, and let's get through this together.
Okay. There's a lot of side conversations going on in here, so I'm just trying to determine where's the next question. Okay. Riley, how can you say that those who are naturally infected are more than likely to get reinfected when the CDC has not one documented case of such?
Hmm. Well, there are documented cases of reinfection. There's no question about that. And there is definitely documentation of more people being reinfected after natural infection than the breakthrough of a vaccine. So that's out there. I'm not making it up. Maybe you should just maybe look at some different sources. Right? I'm not mistaken by all that, am I? Okay. It's not just me. I got people that do this stuff too. So, no, that we're not making that information up as pretty solid as far as the information out there. So.
Okay, Kelly asked, does blood type make a difference with this virus?
That came out really early on, that whole blood type thing. I haven't seen any more of that in the literature. It seemed like it was a little blip on the radar and that people with a certain blood type were more susceptible. Have you seen any more of that? No. So not of anything, nothing that I could really tell you in any kind of sincerity that I know about. Not to mention, I don't know how that would help you because you can't help what your blood type is, right? And it wouldn't change what we advise you to do because you would still be at risk, albeit even if it was just maybe slightly higher or lower, no one would be able to quantitate that. So we would still advise you to follow the same protocols that we are everyone else. Interesting question, though.
Hmm.
Fascinating science.
Just Jessica asked, how many cases do we have to have until the schools go back online?
The schools are committed to trying to stay open, and I don't blame them for that. Kids need an education, and they do they're doing relatively well in school. The schools have paused a number of cases really because they just didn't have the capacity to stay open with staffing. But they were quick to kind of re-engage and get started again. And I think we're going to just continue to support that. Um, if it gets so bad we got to pause again, it's going to be bad, and we'll know it.
Okay. And it looks like the last question so that I see is from Jamie. I'm getting on a plane early in December and I'm so scared. Besides wearing a mask and being vaccinated, what do you have any other suggestions?
Yeah, I just traveled too, Jamie, and I understand. I'll tell you one of the things though, there is still a federal FDA requirement of everyone being masked, and everyone is masked in the airport, in the lines. I mean, I didn't see a single person with their mask off, even below their nose. Okay, so there is compliance, which is really reassuring. Again, trying to stay away as much as possible from other people. Um, If you're real concerned, you can always do a test when you get there. Depending on where you go, there's almost always testing capacity. Before you come back, things like that. So that's an option. Please don't travel if you're feeling ill. Just don't do it. Okay. I know it's hard to cancel a trip, etc., but we would really encourage people to just be very conscientious about that. What else? What else could we recommend, Jen? Am I
Well,
missing something?
good hygiene practices
Oh,
too.
yeah, I'm sorry. Hand washing.
Mhm.
You know,
Testing.
I would love to say take a big load of vitamin D and zinc. There's not a lot of data that supports that, but it wouldn't hurt to make sure that you're nutritionally up to date and you're taking, if you need to take some vitamin supplements, do it. I don't really know what to tell you as far as zinc and vitamin D and the doses for that because the data is all over the place with that. But obviously, there's some suggestions that those things might help. It won't hurt to do that. Um,
Hmm.
yeah, that's about it.
Alrighty. Okay, we have two more questions and then we will end. The next question is from Frida. Any chance on the state joining other states in offering booster shots for all against the federal government recommendations?
Gosh, did I not just see that the governor just suggested that? Maybe I was crazy. Didn't she just release something like that? I don't know. Yes, I would think that there's a chance of that happening, and I think there's a chance of the ACIP officially recommending it. They're meeting, I believe, soon to discuss just that.
Mhm.
I've said this all along that the official recommendations are boosters with certain high risk individuals over the 18-year age and anyone over the age of 60. But, you know, high risk conditions include things like hypertension, obesity, a whole myriad of common medical conditions, and no one is going to ask you to prove it. So I'll just say that we're not turning away people who are requesting boosters because the other condition for a booster is believing that you are high risk because of the occupation or your exposures to other individuals. So, say you are a firefighter or a school teacher, those are valid indications to get a booster. So, again, I just think it's pretty wide open. If you feel vulnerable, I would just suggest that you seek out a booster.
All right. And then the last question from Tracy is so are you saying get tested on Monday before Thanksgiving gathering, right?
Yeah, well, that's because some tests, if you can't find a rapid test, some tests are going to take 24 or 48 hours. I think some as much as 72 hours. So a Monday test would make perfect sense. If you've got if you got a rapid test and you know you got a rapid test, you could do it on Wednesday. You could do it on Thursday morning before you go. All right. The reason we tell you that 48, 72 hours is some of these tests are just they take longer to come back if you can't find a rapid test in your vicinity. So the idea is that if you've done a testing and you know between the testing time and the time that you're going into this setting of close encounters that you haven't had any high risk exposure, it gives you a certain amount of comfort of right. So now what I wouldn't want to suggest you do is get tested on Monday and go to a couple big parties on Tuesday and Wednesday and then go to your you know what I'm saying? So you gotta just kind of put it all together for yourself. I'll just say this. So at the beginning, we shut everything down and we told everybody what to do, and you can't do this and you can't do that. And then we tried to do it in a more nuanced way, and there's a lot of pushback and backfiring and all this stuff. So now we're in a place where everybody has to take care of themselves. You all know what to do. If you get tested and you're positive, it should be your responsibility to tell the people who've been exposed to you what's going on. And they should know what to do. And if they don't, tell them to go to our website and look at it, or the CDC website, because it's not rocket science. So you guys are all going to have to, like, just do this, because it's not going away, and there isn't anybody there with a magic bullet that's going to tell you exactly how to do this. And I know that sometimes orders and mandates create an environment like everyone's supposed to do the right thing, and we know they don't. So we're just asking everyone to just do what you know you got to do. Take responsibility for your own health, and take responsibility for the health of the people around you that you love. And if everyone did that, we're going to be okay.
All right. Thank you, Doc. And we'll see everybody back here in 2 weeks.
Happy
Happy
Thanksgiving, everyone.
Thanksgiving.